Hi, and welcome to FSM for Peripheral Neuropathy. This is Dr. Harlan Mittag. In this video, I'm going to talk about using FSM to treat peripheral neuropathies. First, let's clarify what neuropathy is and what peripheral neuropathy is. I'm going to read a definition here. Neuropathy is any condition where there is damage, disease, or dysfunction of nerves. This term can encompass abnormalities in both the central nervous system, which is the brain and spinal cord, or the peripheral nervous system. Neuropathy may result from a variety of causes such as metabolic disorders, i.e. diabetes, autoimmune conditions, infections, toxins, or nutritional deficiencies. The nervous system is separated into two parts, the central nervous system and the peripheral nervous system. In the slide, the central nervous system is pink color and the peripheral nervous system is yellow. In this video, then, I'm going to talk about using FSM to treat damage, disease, or dysfunction of the nerves in yellow. This includes the spinal nerves, the cranial nerves, and the vagus nerve. Here's the anatomy of a spinal nerve. These are the nerves that power almost all of our muscles. They also carry sensations such as touch, hot and cold, and pain sensation from the body to the brain. In addition, they register our sense of movement and position in space. So when you move with your eyes closed, you know where your body parts are because of this nerve input. Here's the peripheral part of the autonomic nervous system shown in the purple and green. This is the part of the nervous system that carries messages from our brain and spinal cord to our internal organs. So we're talking about damage, disease, and dysfunction of any of these nerves, the spinal nerves to the skin and muscles and joints, and the autonomic nerves to our internal organs. These nerves are the wiring that carries all of the messaging from the brain and spinal cord out to the body, and all of the messages from the body and organs into the spinal cord and up to the brain. There are many, many symptoms of peripheral neuropathies, and here are just some of them. When we think of a peripheral neuropathy, we think mostly of disruption of sensations and particularly of pain. Sensory symptoms can include numbness, tingling sensation, or a more intense pins and needles sensation. Can include burning pain, electric shock-like pain, experiencing pain with a light touch of the skin, which is called allodynia, experiencing increased sensitivity to pain, which is a hyperalgesia. Then there are also motor symptoms. This occurs when the nerves to muscles are affected. These include muscle weakness, wasting of the muscle, cramping and twitching of muscles, and loss of control of muscles. Then there are many, many symptoms associated with damage or dysfunction of the nerves to our internal organs. These can be categorized as cardiovascular, gastrointestinal, genitourinary, symptoms of disrupted thermal regulation, and finally eye symptoms. And this is not a complete list of all of the possible symptoms. Now let's look at the different causes of peripheral neuropathies. There are many, many causes of peripheral neuropathy. Remember that a peripheral neuropathy is any nerve outside of the brain and spinal cord that is damaged, diseased, or not functioning right. For the next few slides, I'm going to show you the different possible causes of peripheral nerve damage, disease, or dysfunction. And while I'm going over these, I want you to consider that the same nerve can be damaged or disrupted by more than one thing at the same time, so by more than one item on this list. I'm going to go through these quickly and then review them at the end. So you have metabolic causes like type 2 diabetes and metabolic syndrome. Autoimmune disease can result in nerves being attacked by our immune system. Acute and/or chronic infections, even chronic stealth infections, can disrupt nerve function or cause nerves to be inflamed. Chronic infections can also trigger autoimmune attack of the nerves. Prescriptive medications are toxins from the body's point of view, and many of them are known to frequently damage peripheral nerves, disrupting nerve function and/or causing nerve pain. The statin drugs are a big offender in this area. Organic toxins, particularly pesticides, are also known to damage nerves. Heavy metal toxins, particularly lead, mercury, and arsenic, can cause nerve damage. Mechanical pressure on a nerve, as when a herniated disc presses against a nerve root in the spine, can inflame the nerve and cause nerve pain. Nerves can be compressed in the carpal tunnel in the wrist or in the tarsal tunnel in the ankle, or they can be compressed by contracted muscles, as happens with the sciatic nerve and the piriformis muscle in the buttocks. When scar tissue is formed in the process of healing an injury, the scar tissue can stick or adhere to a nerve, pulling on the nerve. This can interfere with nerve function, cause pain, and weakness of muscles innervated by that nerve. And finally, nutritional deficiencies can cause peripheral neuropathies. The most important nutrients to be aware of are vitamin B12, folic acid, the omega-3 fatty acids, and also coenzyme Q10. Coenzyme Q10 is especially important if you're taking a statin drug. Here are the most common causes of peripheral neuropathies: type 2 diabetes and prediabetes, statin drugs, pesticides and heavy metal toxins such as lead, mercury, and arsenic, mechanical impingements, nutritional deficiencies, and autoimmune conditions, the most common being non-celiac gluten sensitivity. And finally, chronic infections, particularly chronic stealth infections by Lyme, Bartonella, and Epstein-Barr virus. Here is how I'd like you to think of treating a peripheral neuropathy with FSM. There are a number of FSM protocols that treat peripheral nerves. These include the protocols for nerve pain, for toxins in nerves, for nerve infections, for restoring nerve function, and finally for removing scar tissue from nerves. Then there are the FSM protocols to treat the root causes of the peripheral neuropathy in question. Let's take, for example, a peripheral neuropathy caused by a deficiency of omega-3 fatty acids. In this case, we would use the protocols for nerve pain and then also the protocol to restore nerve function. But we don't have an FSM protocol to magically make omega-3 fatty acids. So we're going to have to take an omega-3 supplement to correct this root cause. Now let's take the case of someone with a disc herniation pressing on a nerve exiting the spine and the low back. Here we would use the FSM protocols for the inflamed nerve, a nerve pain protocol. We would also use an FSM protocol for spinal disc injury to help heal the herniated disc. We would use both of these together on a daily or hourly basis. Then, as we started to improve and there was less pain, we might start to do some back exercises. We would also be wise to take some large doses of omega-3 fatty acids for their anti-inflammatory effect. Or perhaps we would take curcumin, another natural anti-inflammatory. And if the pain was really bad, we might need to rely on a pharmaceutical anti-inflammatory for a while. Here's a summary of the FSM protocols that we might use for nerve pain from a herniated disc in the low back. So you see the root cause is mechanical compression of the S1 nerve root caused by a herniated disc at the L5-S1 level. The damage or disruption is to the S1 nerve root, which is part of the sciatic nerve. Your pads would be placed on the low back and on the bottom of the foot of the affected limb. And at the bottom right, you can see the protocols listed. To treat the nerve pain, you would use the protocols bracketed by the red bracket, nerve pain polarized, or nerve pain alternating. Then as you recovered, you would use nerve remove scar and or restore nerve function. At the same time, to treat the root cause, you would use the spinal disc acute protocol or the spine degenerative disc with radiculopathy protocol. For these, your pads would be on your spine and on your abdomen. Let's look at treating diabetic neuropathy. In this case, we would treat the involved peripheral nerve with the nerve pain or diabetic neuropathy protocols. And to treat the cause or root cause, we might use the insulin resistance, insulin leptin sensitivity, and liver NAFLD, which is non-alcoholic fatty liver disease protocol. The red bracketed protocols would be used for the nerve, and the blue bracketed protocols are to reduce insulin resistance, which is the root cause of type 2 diabetes. Here's another case. In this case, we have nerve pain or dysfunction of the sciatic nerve, and the official diagnosis is idiopathic peripheral neuropathy, meaning we don't know what the cause is. But the nerve pain began about 8 months after starting to take a statin drug. So we're going to use the nerve pain, nerve toxicity, and small fiber neuropathy protocols to treat the nerve. Then we're going to use the liver and kidney detoxification protocols to try and help clear the statins from our body. And finally, we're going to communicate with the prescribing doctor saying that we want to stop the statin for 3 months to see if our nerve pain improves when we do so. So we're treating the nerve and we're removing the root cause of the neuropathy. Autoimmune conditions are very complex. When you know that the cause of your peripheral neuropathy is caused by autoimmune attack of your nerves, you can usually get relief of nerve pain and dysfunction by treating the nerve with FSM. You would use the nerve pain polarized plus protocol, the nerve toxicity protocol, and the neuropathy small fiber neuropathy protocols to treat the nerve. But then you want to also treat the autoimmune attack of the nerves because this is the root cause. Some of the FSM protocols that you would use are vagus nerve stimulation, the quote autoimmune protocol, the Th1, Th2 rebalance, support Th2 protocol, and the concussion plus vagus protocol. These last protocols try to calm down the immune system to slow down the attack on your nerves. We know, for instance, that stress aggravates autoimmune conditions. The vagus nerve protocol and the concussion plus vagus protocol help to de-stress the nervous system and the entire body. The autoimmune protocol and the Th1, Th2 rebalance protocols focus on adjusting the immune system's internal balance to reduce the attack on our own tissues. From a functional medicine perspective, autoimmune conditions are mainly caused by these 4 factors. So the 4 root causes of autoimmune conditions generally are leaky gut, toxins, pathogens, and food antigens. A leaky gut is a condition where the inner lining of the gut breaks down and becomes permeable or leaky to the bacteria and other microbes and food in the lumen of the gut. This leakiness allows toxins, bacterial pathogens, and not fully digested food proteins to pass into the gut wall where 70 to 80% of the immune system lives. The result is activation of the immune system. The immune system becomes overwhelmed and is thrown into disarray. And a confused immune system is more likely to mistake friend from foe. And this is what happens. Eventually, it can begin attacking our own body. And while FSM can help to reduce the impact of the immune system's attack, in order to stop the immune self-attack, we have to address the root causes. In the next slide, I want to address a very common root cause of peripheral neuropathy due to autoimmune self-attack. That is peripheral neuropathy associated with non-celiac gluten sensitivity. The study on the left is titled Treatment of Neurological Manifestations of Gluten Sensitivity and Celiac Disease. And I'll just read from the middle paragraph under the heading Recent Findings. A range of debilitating neurological manifestations is increasingly being recognized in patients with gluten sensitivity with and without enteropathy, even in the absence of gastrointestinal symptoms. Ataxia is the commonest neurological manifestation, followed by peripheral neuropathy. Epilepsy, headache, encephalopathy, various movement disorders, cognitive impairment, and muscle disorders have also been linked to gluten sensitivity and celiac disease and are discussed in this review. Strict gluten-free diet is an effective first-line treatment of the neurological manifestations of gluten-related disorders. On the left of the slide is an individual's account of their experience with gluten as the cause of their own peripheral neuropathy. It is titled Gluten Intolerance and Peripheral Neuropathy, and I'm just going to read what they wrote. I was diagnosed with idiopathic small fiber neuropathy 6 months ago and have not found any relief from any of the regular medications. Not content to accept the idiopathic diagnosis, I have been trialing diet changes and have finally had success removing gluten. I was diagnosed with non-celiac gluten intolerance years ago, and while I am generally gluten-free, I have not been 100% strict for quite some time, until October of last year, and instantly felt my pain reduce and could almost feel the affected area retreat down my legs, leaving me with just occasional burning in the tops of my feet. So all good for a couple of months until I stupidly relaxed my diet over Christmas, and over a week had 2 small pieces of Christmas cake and a handful of chips coated in beer batter. Since then, my pain has returned with a vengeance and has failed to reduce over a week since eating gluten. Has anyone else experienced going off a known irritant and then having a major reaction from just a small amount when reintroduced? The answer I would say is yes. I have heard many clients report this. If you have a peripheral neuropathy, I would suggest going off gluten on a trial basis to see if you notice any improvement. That's the bottom line. To summarize, FSM can be used to treat the nerve damage and dysfunction in peripheral neuropathies caused by an autoimmune attack. And you can also treat the immune system directly, as I showed in a couple slides back. But unless the triggers to the autoimmune attack are identified and removed, the immune system will continue to attack the nerve, and the symptoms of the peripheral neuropathy will continue. Again, to hammer the point home, for the sake of illustration, consider a peripheral neuropathy whose root cause is an autoimmune attack that is triggered by gluten. Treating the nerve and the immune system may provide temporary and welcome relief, but eating gluten will re-trigger the immune attack and reignite the symptoms. It would be like pouring water and gasoline on a fire. You can't put out the fire that way. Shingles is a well-known example of a pathogen, in this case the herpes zoster virus, infecting a nerve and causing severe pain along the course of the nerve. For an acute shingles infection, there is one FSM protocol that can work wonders. It is the shingles protocol with frequencies to neutralize the herpes zoster virus. Some years ago, a patient that I had known presented with acute shingles and described 10 out of 10 pain. She had been on acyclovir, corticosteroids, and gabapentin for a week and still had no relief. After treating her with the shingles protocol for 3 hours, her pain dropped from a 10 out of 10 to a 4 out of 10. When she came back the next day, the pain was back up to 8 out of 10. And after another 3-hour treatment, the pain dropped to 2 out of 10. And then over the following week, the pain went away completely without any further treatment. Another peripheral neuropathy is trigeminal neuralgia. The trigeminal nerve is a cranial nerve, meaning that it exits the brain. There are many suspected causes of trigeminal neuralgia. FSM treatment includes treating the nerve, the blood vessels around the nerve, and the part of the brain that the nerve originates from. Since there are thought to be a number of root causes of trigeminal neuralgia, and it's hard to diagnose, the treatment tends to focus solely on relieving the symptoms. I showed the concussion protocol here as a root cause treatment simply because trigeminal neuralgia can be a very stressful condition, and the concussion protocol is good for relieving stress in the nervous system. I'll summarize what I've gone over in this presentation here. When you're treating peripheral neuropathy, you will be treating the injury, damage, inflammation, and dysfunction of the nerve itself. But then you're also going to want to treat the root cause if there are FSM protocols available to treat the root cause. I've given examples such as a peripheral neuropathy associated with a chronic infection. In that case, you would use the FSM protocols for infections in addition to treating the nerve directly. I also gave an example of a peripheral neuropathy caused by pressure on a nerve from a herniated disc. In that case, you would treat the disc and the nerve both. The same is true for other types of peripheral neuropathy. You want to treat both the nerve and the root causes when there are FSM protocols available to do so. And in addition, you want to identify and remove any root causes of the nerve damage. I gave examples such as removing gluten from your diet. This was in the case of autoimmunity triggered by gluten. I also gave the example of stopping a medication after consulting with your doctor. Or in the case of a nutritional deficiency causing neuropathy, you would want to add the nutrient. I gave the example of omega-3 fatty acids. Unfortunately, peripheral neuropathies can also be worsened by problems that develop in the central nervous system. Whenever pain becomes chronic, meaning whenever it lasts for more than about 3 months, the pain processing apparatus in the central nervous system can go haywire, resulting in increased chronic pain. This is sometimes referred to as increased central sensitization to pain. Audio amplifiers have a control called the gain control. Increasing the gain increases the sensitivity to any signals being received. In chronic pain conditions, the central nervous system can essentially turn up the gain or sensitivity to pain signals. This creates a whole additional level of problems and complexity when it comes to treating pain that comes from an affected peripheral nerve. In the next video, I'll talk about treating pain that is caused by problems with the central nervous system, the brain, and the spinal cord. I'll see you in the next video.